time. We are extremely blessed and lucky to have with us the Acting Secretary of the Department of Aging for the Commonwealth of Pennsylvania. I use the word acting because confirmation should happen in the state legislature sometime in the second week of May or so. But I still, to me, it's Secretary Duke. I asked the Secretary's office to send me his bio so that I could talk about who he is and what are his accomplishments. And it's very impressive. And I can give you some highlights. He was Executive Director of the New Jersey Foundation for Aging. He was the Director of Geriatric Program Initiatives with the Institute on Aging at the University of Pennsylvania. If you look at this list, it's a lifetime of commitment and service to the aging population and to the aging members of our society. But there's really a different way to talk about an individual, and that's to talk about the individual as if it's a bookshelf in a library, and I'm giving you some of the books that are inside the library. But we all know that on a shelf, the two most important books are the ones that make up the bookends. They hold up the rest of the library. And in the case of Secretary Duke, there are two very interesting bookends. One is obviously the first book in his career, and that book, I don't know if you know, but the Secretary is a graduate of the University of Scranton. So that makes for a very interesting first book to read about the accomplishments. The second bookend, is actually not really an accomplishment of intellect, or it's not an accomplishment of career. It's more of what I would say the measure of the man. Turns out that Secretary Duke flew into Philadelphia this morning on the red eye from California, went home, which is outside of Philadelphia, changed his clothes, got into his car, and then drove through this mess to attend and to make the keynote address for us today. And that's a measure of commitment. That's a measure of a man's or a person's vision of what may be important to him and to us, and it speaks volumes. So without going through all of the books on the bookshelf, because we don't have to, we already know what the first book is, we know what the start was, and we also know the personal book. That's the last book in the row as of today. So without any more delay, I'd like to introduce Secretary Brian Duke, the Secretary of Aging, Department of Aging for the Commonwealth of Pennsylvania.
How is everyone today? It's good to be home. I want to say thank you to a few people here. Doctor, that was an incredible introduction. Perhaps Senator Blake, we can use that on the Senate floor when my name's put up for a vote. I don't know. I want to thank the Senator. The Senator understands community and the discussions we've had since I've arrived in Harrisburg. It's been an honor to meet him. Understands the challenges faced by our older population, and I'm grateful that he helped facilitate my invitation to be here today to come home again. It's nice to meet you, Sharon. Greetings to Senator Casey, please, and the Dean and everyone else who I met here today. It's good to be home again. I came in and Dr. West was telling me about the Health Administration Program, and we were sharing some good stories about people that are involved now in the advisory committee, and so I really do feel like I'm home again. Are there any current students in the room? Yes, good. Well, as students, please keep an open ear to what I say. Even though some of the comments may be directed towards research, think of them as ideas to instill and inspire. I hope we need more people in this great field of aging. When I talk about research, and I was so thrilled first to know the theme, but then to come and see this cover. There is such a need in our Commonwealth for dedicated efforts to research what is necessary to help our elders. The need goes beyond just the rigor of research. It goes to what we can translate into practice. And often that's the gap that we know as researchers. We know that there's challenges to research. We know if we don't define the journalistic questions as we define the research agenda, the what, when, why, how, where, we could get a little bit lost in our endeavor. We know that there are challenges, that research may not endure beyond a funding cycle. We know that there are many studies that end with unheeded calls for further research. We know that there can be errors in projecting our findings as we work hard together to do research. And we know the attention to rigor can vary at times. But we also know that good research helps towards replicable practice. We know that good research can help others move forward. And I was pleased today to meet, in the brief time since I arrived in the door, people from a variety of disciplines. How exciting that is. Because as I talk later, it is about the person before us, and that person isn't defined in silos. So we have to talk about what's being done out there now in terms of gerontologic and geriatric research and the opportunities we have before us. My thoughts today may appear to be a little bit random. That could be due to fatigue or the vastness of what we're trying to endeavor to discuss today. And so I hope you're patient with me. We looked at Pennsylvania. I understand you've talked about us and our rankings, right? You've talked about our population, third highest in percentage of population who are considered older. We know there's an increasing demand for service, and we know that resources to meet all those demands aren't necessarily well connected at this time. And that's because I believe that no one sector of our society, I think we even shared this in discussion, Senator, when we met, will be able to meet the entire demand. So I surely don't stand here today, even though I'm honored and humbled by the governor's nomination, to say that the state government should provide all, or the federal government should provide all. I stand here today as a call to community to come together so that we can meet those needs together. Things we may know or not know in our endeavors are that what we considered one generation as I was growing up, you were fortunate if your grandparents were still living. You were very fortunate if your great-grandparents were still living. Now, what was one generation is now four. When you say the word older, you mean four distinct generations of people, at least, with different learning styles, different feelings about accessing services that exist. We know that we also see incidence rates of chronic illness or terminal disease growing with this increasingly large population. But there are other demographic trends we need to be attentive to. They're the trends of cultural diversity that exist, maybe here in your communities of the Northeast, and maybe in other communities throughout the Commonwealth. And we know that there are differences in what we consider to be longevity and what long life is. I mentioned earlier the importance of the holistic view of the person. This actually started for me in the hallways of Moses Taylor Hospital, where a young administrator, Tom Senker, taught me the value to manage well is to know the persons we're serving. And so inspired in me a habit that I kept as a hospital administrator of around 6 o'clock when you're really feeling disconnected. And I imagine you as researchers at times, depending on your field of endeavor, can feel disconnected, from what the impact is. I used to go to the patient's room, a random room. Staff used to love this. Just go in and say hello and have a conversation with the family and the patient. And what happened during that interchange really told us what was needed, what was wanted, and what was necessary. We know that as we look at research, connecting the lines between research effectiveness and our communities can be difficult. We know even in our systems of care now that there's a gap between our medical and social perspectives and our social care systems. So what do we know about this holistic person who stands before us? We know that they're emotional. We know that they have mental health as an aspect of their being. They have a spiritual aspect of their being and a physical aspect of their being. And you as researchers in your fields of endeavor may define more subsets of these four major categories. We at the Department of Aging of the Commonwealth and the Office of Long-Term Living endeavor to engage persons where they are so that they can make decisions to receive the care they wish to receive, where they wish to receive it, when they wish to receive it, and how they wish to receive it. And we do this through the provision of community services, which can include everything from information and referral to senior employment, nutrition programs, transportation programs. We do it through long-term care services. Another generational difference, when I talked about long-term care, as I started out in the field of hospital administration, you know, it meant the nursing home down the street. And now we know that long-term care as a continuum includes home and community-based services as well as institutional care. And the last thing we do in the Commonwealth is to protect our elders from abuse, from neglect, from exploitation and abandonment. And I mention these areas so you have a better understanding maybe of what the department does, but also so you may hear words that inspire you. You know, what can we do in the field of criminal justice to research or criminal studies, how we can protect people longer and better? What can we do to enhance connections in the community? What can we do to measure the effectiveness of long-term care? Pennsylvania is recognized for its leadership. The Family Caregiver Support Program that now exists across the country was a replication of our program. We have a lottery here. I just came from California where we are indeed fortunate that we have a lottery here. I was talking to a group of Californians saying, well, we have a deficit of, is it 4.3, 4.2 billion? And our total Commonwealth budget is around 27.3. And it was interesting to see the reaction because that's the deficit in California. So our entire Commonwealth budget is their deficit. So we know we face challenges. We know that we have support for our services here in the Commonwealth beyond the lottery. The Older Americans Act, which will be up for renewal next year, and will be an important document, I would think, this inaugural group, and I hope an ever-growing group, will want to look at, because it can help define a little bit of history since 1965 when that act was passed, just before Medicare. That act is very important because it defines those social connections that are so vital to keep our elders well. And in these communities of northeastern Pennsylvania, that is indeed vital. One of the things we have to look at was well, what do we look at when we look at systems of care if we're considering research? I think we have to look at how they've evolved. You know, we have to look at the silos that exist because a system of care was developed based on a unique funding stream that was defined in a particular manner. We have to look at the disconnects that exist between medical assistance, Medicare, and the Older Americans Act services. This is an important issue that Assistant Secretary Kathleen Greenlee just identified yesterday in a keynote to the American Society on Aging in California. There's a disconnect. All three of these are noble endeavors. Medical assistance, the safety net, which includes our elders, you know, those in greatest economic and social need. Medicare, which we're familiar with, and the Older Americans Act. There needs to be more done in terms of research as to how we can better bring these programs together. It's a 46-year-old problem, but one that we need to endeavor to fix. We need to look at how we navigate care systems and do research on what would work best. We look at primary, acute, post-acute, and long-term care. Very difficult to navigate from one to the other. And how can we best do that navigation? How can we help people do that? We need to look at the largest provider of long-term care in our nation. We need to help them. When I say them, the family caregiver is the largest provider of long-term care in our nation. But yet the supports we offer them sometimes aren't enough. And we need research in the social arena and maybe even in the clinical arena, because some have posed this as a public health issue, that caregiving becomes a public health issue because morbidity and mortality increases with the family caregivers as they care for the one they love. It's an important issue to keep in mind, and any research in that endeavor can help us. In Pennsylvania, we talk a lot in the department and beyond about rebalancing care. In some states of the nation, the balance between what would be considered institutional care or nursing home care or assisted living facilities, personal care homes, and care that would be delivered in what would be called home and community-based services is 50-50. And here in the Commonwealth, we've made movement over the past several years to correct what was a very bad statistic for Pennsylvania. We were in the 40s when you rank the states in terms of rebalancing care. We've gotten to a point where it's probably about 80-20. 80% still going to institutional care and 20% to home and community-based services. But if I look at elders, it's 90-10. And when I stand here today, of course I'm an advocate for home and community-based services. I'm an advocate for team-based care. That's personal, right? And you may be as well. But we have to look at how we can rebalance that care. And as I stand here today, I don't say that nursing home care is not necessary. Some advocates in the industry have said, well, he speaks against us. You know, he doesn't want nursing homes to be around. It's not that I don't want them to be around. It is a necessary level of care that someone should be able to choose if they're able. If not, the family should be able to choose that level of care because it's necessary. But we do need to look to balance. We need to balance the care. Research on how to do that better would be most welcome. We have to do studies, and maybe through our business schools and schools of economics, on the market forces and resources that are now part of the long-term care continuum. What is the right balance for a community? What components do we need? How do we encourage as a catalyst or stimulus for the development of the services we need in our community that may not exist? Research agenda has several items that I'd like to talk about. One would be in long-term care. In the institutional side, we have benchmarks that tell us if I do intervention X, outcome may be Y, and I can watch and see. So I administer medication, I give nutrition, I monitor whether nutrition was received, I do all these things, and maybe I can see what happens. I can see an outcome. In home and community-based services, there are no really defined measures. There have been studies and calls for further research that would tell us the impact and effectiveness of social care interventions. There's probably a variety of reasons for that, but I think it's an important agenda item that needs to be considered. Because as dialogues take place in the public sector, in legislatures around the country, and here in our Commonwealth, or in other arenas, we need to talk about if I do social intervention X, if a personal care assistant goes to the house, helps someone with their bath, their housekeeping, home modifications, maybe takes them out, does their what does that do for that person in terms of their life? You know, is it impacted? I can tell anecdotal stories that'll keep you here for the whole afternoon, but anecdotal stories are important. The person before us is valuable when we're talking about what we need or want, but we need the data to tell us that it's working. We need the data that can connect our medical and social services together. And so for a tradition that has been based on a focus on outputs, X number got a meal delivered, Meals on Wheels, you're familiar, right? X number went to the senior community center and participated in an activity. But we don't know what those interventions do beyond that. You can't speak about it in numeric or measurable terms. We need to do research on how people progress along the continuum of care. We know all of you come from different disciplines. We know that some of you may be the bench sciences, you know, looking into the root causes of disease, looking at the discovery or testing of interventions, perhaps identifying indicators for healthy living or deferring the onset of disease. In clinical research, you may be looking at, geez, when I went here, there's a school of nursing here now, right? There's a school of, there's a school of therapies here now, right? Physical therapy, occupational therapy. Boy, what amazing accomplishments here at the university. Grown out of the roots of bench research though, right? Loyola was at bench research, right? preparing people for the health professions disciplines, but how great they can stay here now and study if they choose, or come here. The clinical research, you know, what interventions? When I was at Penn at the Institute on Aging, we were looking at how do we have to deliver care differently in the outpatient setting, or the ambulatory setting, or the primary care setting? How do we have to do it differently in the inpatient setting? How important is it that care in geriatric medicine be delivered in a team setting? How important is it to help any physicians here? The challenge of the integration of geriatric medicine sometimes in the care setting is a challenge. And how do we best help that? We know there are studies out there that probably show the effectiveness of geriatric medicine. Another arena of research, health and wellness. There are evidence-based programs out there telling us if we do intervention X or have somebody participate in program Y, that there's going to be this particular outcome. We need more of that, simply said. We need research that would help us towards what is now a movement towards person-centered care. When I was in hospital administration early on, we used to talk about that. And physicians, nurses, and administrators would sit at table when someone came in to tell us that, and we'd say, what do you think we've been doing all these years? Our hands are with the patient. We're there with them. But it's really different in this regard of the elder. And it's different for all of us. It's our ability to choose. You know, I went to visit a village. Are you guys familiar with the villages models that are taking root across the nation? They started in Beacon Hill section of Boston. This is an idea of a volunteer-centric model where members of a community come together and make a definitive decision that they're staying in their community. And they're going to do anything they can to stay there. They're going to recruit volunteers to come and work in the community and offer services to their neighbor. Not such a different concept, but one we need to reinvigorate in our neighborhoods. And if volunteers can't do it, they've vetted a list of businesses and done background checks and gotten discount deals for businesses that will deliver services. And if that doesn't work, we'll also have social connections where maybe people will learn from each other and support each other who are members of the community. When I went to visit the village in Washington, D.C., it's called Capitol Hill Village, it's in the southwest section of Washington, I said, well, how are you meeting that person's needs? And the woman, whose name I can't remember right now, was sitting there, and she looked at me and she said, oh, we don't use that word. I said, what word? Need. I said, what word do you use? They said, we only speak in terms of wants. I want to go to the doctor. I want to go to the hospital. I want to. You see the difference between those two words, need and want? It's dramatic. It's a small example of what it means to be, I believe, person-centered. It's the person is making the decisions. We're looking right now at the state on how we can do that in the context of the long-term care services we care manage now so that they can allow more decision-making. We need to look at research on technology. There's an amazing arena of technology out there that's helping people stay in their home and in their community. Everything from webcams with consent to instruments that can measure blood pressure and other readings and report those readings back, to instruments that monitor motion in an apartment. There's an apartment building down in Germantown section of Philadelphia built by an organization called New Cortland. They're from the Philadelphia Presbytery Foundation. And it's wonderful. These people who would be deemed to be nursing home patients or residents can now live in an apartment independently with technology monitoring them so that they're safe and well and intervene when necessary. There's a great arena there in biotechnology and other areas that I would say should be on the research agenda. The managed care marketplace, another arena where I think many managed care companies who have done good work over the years in the hospital sector, hospitalization sector of care, let's say, or in the primary care sector, are now in long-term care saying that there is an opportunity to be found there to help. So insurers and payers are entering into the marketplace in terms of managing care. I think this is an okay part of the market. I think we have to enter it with caution, but that's all I can say right now. I need data to say, is managed care an effective way of delivering long-term care services? There are probably some studies out there that have been supported by these businesses that would tell us so, but it is an important area of research. Another area of research in labor, in workforce development. What are we doing to develop the workforce? Who are the people we need to have working with our elders in the community? What are we doing to grow civic engagement or volunteerism in our communities? We look at research too. We have to look at the holistic view of the community, not just the holistic view of the person, and ask ourselves hard questions. Can our communities look different and be different? So it's not only about the person aging well, it's about our community being a place to age well. Can we study innovative practices that change how we view our community, the settings in which we live, the way our communities are designed, the infrastructure, the way people interact because of those design purposes? And one of the areas that I think about are do you have 55 plus communities up in this area? I don't know if you do or not.
All of our communities are 50.
All the communities, okay. So you have one big one. I'm referring to the communities that are built, I guess, for those who could afford it, right? And I know that's a challenge here that not many can. But in other areas of the Commonwealth, these communities exist, and I'll go and speak to them. I went to one group, and I was walking in to speak, and this couple comes, suntanned in their Mercedes convertible, so definitely not among the greatest social and economic need, and racing down, and they see me walking in with my boxing mitts. What are you going to talk about? And there were like 80 people in there on a Saturday morning. I was really impressed. They wanted to come talk about aging. I said, we're going to talk about aging. They said, not for us, and off they sped, right? So, total denial. I'm in denial. I know when I come back for the university reunions that I look the same, and my classmates, not so good. But we have to look at how we get people to accept more about aging and talking about aging and integrating it. It's a dialogue that's necessary. The great theologian Henri Nouwen would tell us it's about accepting our own aging first before we can reach out to the other. So that's an important thing as we look at our communities. But those 55 plus communities, I stood there and I said, what's 55 plus 10? And there was silence in the room, and everyone seemed pretty comfortable with that, because I had asked them, is this your last move? Is this it? Is this where you're staying now? You're not packing another box? You're not doing that anymore? Yes, this is it. I said, what's 55 plus 20? And from the back of the room, a woman says, our covenants prohibit it. I said, what, being 75? What do they prohibit? She said, our covenants prohibit me from hiring anyone below the age of 55 to live in my home and care for me. I'm a woman of means. I'm proud to say it, and I'm going to be able to hire anyone I need to care for me in my home. I'm going to be able to do that. I said, you're very fortunate and blessed to have that. But she said, our covenants prohibit it. Another woman yells out, our covenants prohibit something else. What's that? We can't have ramps in front of our houses. So these dialogues that take place in these 55 plus communities, that municipal planning places on the outskirts of our communities that are considered real blessings to the tax base, especially school districts, right? All good stuff. But when they become an island of isolation with peers all the same age in need or wanting different services, we have a challenge. So I bring that up as an example of what we need to do in municipal planning in terms of research. Other areas other sectors where planning can take place that may not be on the forefront of people's thinking right now are entrepreneurs. Met a young man from Penn State. He has a company. He's trying to design, well, you have alley streets here in Scranton, I remember. The garage in the back, right, and the house out front. He wants to convert the garage to a house for mom and dad, and then son and daughter, son and/or daughter move into the big house up front. It's adopting a principle from the Amish. They have a granddaughter house, right? They do that. They switch the households, and they care for their parents as a cultural norm. That's an example of planning beyond. We need to look at economic development. This young man went forward and said his economic development was to build a smaller form of assisted living. So if grandma and granddad can't stay in the house, they can go live in this smaller, more home-like assisted living and have retail, Starbucks, Barnes & Noble underneath that would attract the younger populations to shop. And oh yeah, while I'm here getting my latte frappe grande, I can't speak the language of Starbucks. I can go upstairs and see grandma and granddad. These are the things, though, that need to have research. We don't do these things either in a business motive or a care motive on a whim. We have to know that they work. We have to look at intergenerational involvement. We have to look at, then, the person to community. the holistic person living in a community that looks at the person as holistic and is holistic itself. The questions we may ask is, what is the cause or treatment for a given disease, injury, or social issue which inhibits a person's choice to live in their home and community? Does the intervention or medical or social service have an impact? Do current services have an impact, as I mentioned, particularly home and community-based services? Are our communities ready? There are a few tools that have been developed out there, but there's a need for greater research on assessing communities' readiness for aging. Are planning decisions based on the projected needs and wants of residents? Are there models of living and care which could be developed together to help meet needs and fulfill wants? Are aging in place models effective? These are gaining pace right now. There was a national meeting I went to in Philadelphia last year. They're gaining momentum. They're beginning to talk to each other more and more, and it replicates almost how hospice started in our nation. And now hospice is commonly accepted. People may have different opinions about it, but it's commonly accepted. They see themselves as the frontier men and women of this new movement of staying in their community, but they don't have the measures to say what they're doing is effective. How do we address gaps? How do we measure those gaps that exist? And how do we use that as a formal discussion in public arena for discourse and decisions? What possibilities exist for economic development that engages all generations? Not all of our elders are in greatest economic and social need. Some of our elders are of means and have wealth to invest, to spend, not only wealth of money, but wealth of time and knowledge. Time, talent, treasure, and fundraising principles, right? How do we instill neighborhood connections once again? Of the discovery and calls for further research, what is translational to the community? What will help us focus on the whole person? A call for interdisciplinary collaboration. I was really impressed with the different disciplines that were gathered here, looking at the agenda and meeting people as I came in. I did a real brief lit search with my fatigued eyes. In 1980, some of the articles in a journal for research and aging were elder retirement migration, nursing home satisfaction, and attitude towards the elderly. In 2010, it's about later life employment preferences, work and family characteristics as predictors of early retirement. These are different topics, indicating that not all of our elders are in need, but yet we need to be ready to serve. When I have talked to different groups going around introducing myself, I've talked to them lastly about time. And I've said this is a time of challenge, most certainly, but I believe it's a time of great opportunity. I missed the fundraising part in the beginning. Development and others were at table. But it really is a time to envision, especially in the research arena, how you can come together. I really believe that it is a time of opportunity. It doesn't deny the challenges we face, but they are there before us, making connections that haven't existed, reaching beyond the silos of our passion and our mission and our interest. As I've also gone around, I've challenged people. I said this is also a time of resiliency, and I'm only here for a limited time, probably after 8 weeks, much to the grateful view of my staff who are wondering, gee, he'll only be here 4 or 8 years. But it's not about me. It's about the older Pennsylvanian and what will be said at this point in time about what happened in the Commonwealth of Pennsylvania for older people. What happened then? Let them talk about that. And I hope one thing they talk about is this. Thank you. Question? I would, yeah. I now promise I'm able to answer them. Yes?
Just have one question, please. Because our culture is not a culture that recognizes the aging. What would your thought on this? Because we are, really promoting youth, and compared to the country that I was born that or fostering that kind of messages to the culture?
It's interesting. We come from a diversity of cultures that formed our great country, and most of them came with strong caregiving values. Some cultures don't have a word for caregiving. I, at times, have committed heresy and not used the word aging. I've started with an analysis of the community. And then in the community are people who happen to be older. Sometimes that's the door to get in. I don't know in terms of RFPs that are out there, requests for proposal, or requests for investigation that are out there, whether there is such thing as to look into some community aspects, but there could be. That's one way to do it. And I think we need to instill, and it could be researched, what is effective in helping people make that transition from the view of their own aging and what they need for their future or want for their future. So, I mentioned the villages concept. There's so many things going on out there. There's a group of people out of Berkeley, just out having been near them, you know, they're thinking back, now was there a time that we kind of lived together, kind of hung out, cared for each other? Oh yeah, let's go do that again. Let's go back to the commune days, you know? Some people are buying closed military bases and hiring a sociologist to research with a population that is committed to live together what's important to them. Everything from, do you want to eat together or do you want to eat in a private kitchen in your house? Do you want to have an art studio where everyone comes together, a entrepreneurial business creation center? What do you want to have and how can we go about that? And then hands that finding over to an architect who draws it. You know, these are some of the innovative things that are happening around the country. So I don't know if there's any magic to get us from a crisis orientation about our aging to a more fulfilled view of our aging and what it means. So I'm sorry, I don't have any answer, but they're my thoughts. Yes?
Again, it's nice to have you back here at Scranton.
It's good to be home.
It's refreshing to hear some of your comments because you're in such a prominent political role in terms of reshaping what exists here in Pennsylvania. Some of the ideas that we were talking about just make us feel good to know that we're looking at that. But I was wondering if you had given some thinking around this whole idea of public-private sector initiatives and how, you know, the government can kind of launch such efforts, because it seems that there's a lot of innovation in that type of a model. I didn't know what your thinking on was.
Yeah.
Maybe
you know, it's something that, thank you. I'm a strong supporter of public-private partnerships, and I almost see them as one of the vital practices we need to infuse in what's called the aging network. And the aging network is the area agencies on aging that are the government-funded local office. You have one here in Lackawanna County, right? And instilling in them a new role as a catalyst to help pull together these partnerships if they're not forming already in their community. I think we have to think about how we do that more. You know, do we do it through funded opportunities that brings people around a table where we, you know, Senator in a previous career worked in innovative loan programs, you know, do we do that? Do we develop meaningful training programs that help area agencies on aging shift their stewardship from making sure that state dollars are used in the most effective and efficient manner possible to incorporating that, but enlarging stewardship to everyone who's possibly eligible for service. So it's everyone over 60 in this Lackawanna area, not just the hungry and the poor and those that need the long-term care. I don't know if we have a defined path for it, but I would think starting with programs that can incent people to come together. One example is happening now. It's called Care Transitions, and we just had some award-winning experiences in the southwest of our state. Hospitals, through reform and or other ways, are looking at the readmission rates to hospitals. In particular, readmissions that take place within 30 days. And realizing that while we can try to adapt our medical and post-discharge care so that perhaps that readmission doesn't take place. There's a definitive need to link with the Area Agency on Aging or other social care providers so that person stays at home in the community and the risk of readmission perhaps goes down. That's an example of public-private, hospital and public sector coming together. Those dialogues have taken place, as I said, in the Southwest, but they're beginning to take place in greater areas because area agencies on aging can now reply to a request for proposal from CMS that just came out about a week and a half, 2 weeks ago. That's an example. But yeah, so that was a long answer, but that's, is that okay? Or, yeah.
Yeah.
Yes.
How would you suggest getting this need for research out of, just say, this room, and also the availability of these programs to our elderly population?
Well, you're going to do the research, right? What field are you in?
American Studies.
Are you? Well, this is most certainly an issue in our American culture and American studies. But the traditional drivers, the engines of research, when I used to work with the faculty at Penn and admire the great work they did, and all of you know, you have a portion of your work that must be research, right? I'm assuming. One way is to encourage more dollars that would go towards innovation that would move beyond the anecdotal story and give us measurable proof that our home and community-based services are effective in those things. So calls to federal sources of funding, maybe state sources of funding for research. That's one way. The other is to start building collaboration in the local community between philanthropy that may work, the Family Foundation, the foundation that was formed after the sale of the hospital. There's a name for that, and being a former philanthropic leader, I should know the name of it. But it's a restricted foundation that basically says all the donations that went to that hospital have to remain for the good of the community because over hundreds of years, no one anticipated that they would be bought out. So those foundations are great places to go to begin to fund research initiatives. Inspiring people like yourself, who may be in a field of American studies or whatever endeavor, to enter into the arena of research. So it's not only the funding streams that inspire the research to carry out, it's who's going to do it. You know, so does that help? Good. Yes?
What role do you see in addition to research coming from higher education? And what sort of response would you like to see in general from Pennsylvania's colleges and universities, and in particular from the University of Scranton?
Thank you. One, I think this is a great beginning. I think this collaborative effort among the disciplines to talk about a collaborative research, whether it becomes an institute, an organization, or home, I think that's important. The second thing I would ask of our colleges and universities is to instill, particularly among those in the clinical fields of endeavor, an interest in the practice of geriatric medicine or the geriatric medicine-related fields. There are many options open to our nurses and our therapists, our physicians, and now with the Commonwealth Medical College being here, and what are we going to do to endeavor to help see a growth and interest in geriatrics? And I know there's a lot of personal decision-making factors that go into those career decisions, but I think I'd like to see that. I think instilling as a community, and Scranton certainly did this well. When I came here, certainly no member of the Jesuit community stood up at orientation and said, what we're going to do to you over the next 4 years is infuse in you a unquenchable need to serve others. And we're going to send you forth and have you do that. No one told us that. They did it. Among my classmates, each of them, it may not be their total vocation, but I can tell a significant part of their life is service to others, whether it's their family or beyond the family unit. That is unique to Scranton, and that's important. So the academic building blocks, the encouragement to enter into the field of geriatric or gerontologic endeavor, but also what we can do to inspire our younger generations to serve others is really, I think they'd be three things I'd think of.
This kind of dovetails on what he said beforehand, but as a university student and a youth, what other avenues besides research can we take part in? Are there any organizations or whatnot that would help us to become more involved, I guess, in facilitating this process?
You need any volunteers in Lackawanna Area Agency on Aging? Yeah, there's one right there. So exchange contact information. The other is to look at the faith communities. You are a faith community here, but look at the faith communities beyond and how you can go out and serve the people in the community that are elders. Look at the elementary and post-elementary, post-primary school levels. What can you do in the schools to help bring elders in to help mentor? Look at the Meals on Wheels programs. Temple University had a great program called Time Out. If you call the Temple University Center for Intergenerational Learning, except I think they just dropped learning, so it's the Intergenerational Center at Temple. Google those words, they'll come up. And look up the Time Out program and call them and say, Brian Duke said to call because Scranton may have an interest in learning more about that program. And what that did is it built up a core of students who became respite providers of care in the homes of people in need of care. So caregivers, due to their stress, mortality, morbidity, need a break. They need to get away. So students would come. They don't do medical intervention. They don't do anything that's going to won't create liability. They're going just to help and be there with the person, a companion of sorts. That's a great opportunity. And that program has had great success and actually has been researched as being effective. And it's not like a huge commitment because students are busy. It's 2 hours every other week or 3 hours. And what they find is the relationships build between the elder and the student and the richness that in that transition happens. Call up the Senior Community Center and ask them if they need students to come teach the persons there how to text. You want to see a face? Watch a face of one of your students when they get their first text from their grandmother. Watch that. It's what? What's going on here? That kind of interaction is rich, what happens there. So they're just some suggestions. And if none of those work, call my office in Harrisburg and I'll find it. Yes?
There are 9 counties in northeastern Pennsylvania that don't have adult day services. How would you suggest, or what suggestions would you give a person of moderate age to develop interest in how to develop interest in these counties for developing that home and community-based service?
Yeah. That's regretful that there are areas of the Commonwealth that don't have that service. And we tried to, through some funding, I think, in the previous administration, instill that perhaps some would be developed. But we didn't have a lot of takers, and I don't know if that's because the core funding wasn't sufficient. I'm not sure what the reasons were. I think convening public-private partnerships, we mentioned earlier, the hospital CEO, the president of the bank, the community leaders, formal or informal, and getting them around the table and saying, this is a level of care that could really be beneficial here. What do we need to study to say that's true? How do we prove it? There's none, so that's probably going to be a little easier. Where should it be? What should it offer? So, I don't know if that helps.
Well, you see, I'm a person who's already convinced
that you need it. All right, yeah. Well, I think you have to get the right partners on the table who may be sources of investment in developing it. You may look at if there's a successful senior community center nearby, maybe that'll be a great place to start as a aligned program with the senior community center. Sometimes that's difficult in the culture of some of the senior community centers, but you could try it. But I think the healthcare sector may have an interest in seeing that happen. I could be wrong. What do you think, Dr. West? Maybe? It's a level of care that can help keep that person closer in the market to the hospital or health provider. And it's definitely necessary. I used it for my late mother who had Alzheimer's, and it was a great program. So we don't have the machine to put more cash out there, especially in this budget you're coming, to serve as the stimulus to create them, right? But I would definitely see the growth of that sector as needed. So I agree with you on the need. You would know best here who to call the table, though, I think.
Well, if there are no more questions, thank you very much.
Thank you.
Well, we only have, when I teach, I always tell my students how much time is left in the class so that they have something to look forward to. So we've gone through 2/3 of the program so far, and the last third of the program is two panels, one about intramural research, collaboration, and what can be in the future, led by Dan West, and the second is extramural research collaboration, what could be on the outside of the university, also working with the university, and led by Dan Flynn. I'll introduce them in a minute. Before we start the next panel, I just wanted to tell you a very interesting thing about world populations and aging.